Erin, it's Dee.
Hey Dee, how are you today?
I'm good. So is it just Eva and I right now?
Yes, ma'am. I've got a few people coming in from the waiting room, but it does not look like they're members. So we'll give it a few more minutes. It's just now 3:01.
All right.
And I have just a quick brief spill before we get started as well, if you don't mind.
No problem.
It's 3:02 and we have a fairly full agenda. So I'll go ahead and do my brief rundown really quick. Eva, welcome. For a friendly reminder for everyone on the call that if you are not on the committee, please do not vote on minutes or recommendations. We've had some issues in some past meetings recently. So just a friendly reminder that only the committee can vote to approve the minutes and recommendations. Also, if you could please, the first time you speak, identify yourself for the court reporter so that way she can capture who is speaking. And then also, if we could also please speak one at a time and not speak over each other. So that way the court reporter can make sure to capture everything for the transcript. Also, Eva, you're new, welcome. So I do want to let you know as a committee member, when you vote, you do have to have your camera on so that way we stay within the open meetings laws and regulations. I'm not sure if anybody gave you that rundown yet, excuse me. So that's all I have. Dee, if you want to go ahead and get started. I don't see that Lisa has logged in yet. Oh, this might be her. Oh, it just said El Gray. I don't think that's her. So I will go ahead and turn it over to you, Dee. And
Well, we don't have a quorum. I think we need one more member to make a quorum, so we can't vote on previous minutes. And Erin, if you could remind me, I think we haven't voted on April and June minutes. Is that correct?
I believe that is correct. If I see anyone else come in, I will let you know if you get a quorum established. You have 5, so you should need 4 for your quorum, over 50%.
Oh, okay. All right. And so we've had the addition of April Hester and Eva Stone into our nursing TAC. And I don't see why, Eva, you can't introduce yourself. For any of the participants that don't know me, my name's Dee Polito. I'm a certified nurse midwife. And after I received my doctorate, I took a faculty position at Frontier Nursing University, where I was a graduate in 1997. So I'm there full time, and I am back and forth between Kentucky and Florida quite a bit. I'm in Florida right now, and it's just lovely. So Eva, welcome to the group. If you could introduce yourself.
Thanks, Dee. Yeah, I'm Eva Stone. I am a nurse practitioner, family nurse practitioner, and then got my doctorate in systems leadership from UK. I have worked in school health for about the last 21 years. I've also worked in a clinic setting and then done a lot of immediate care within all of that. But just I'm at Jefferson County Public Schools now, which is by far and away the largest place I've ever been. The biggest school district I was in prior to here had 3,000 students. Now we've got 96,000 students. So it is an adventure, but I'm really excited for the things that are happening in the state. So I'm glad to be here.
So we were going to be voting on our chair and co-chair. We can't do that today because we don't have a quorum. And Lisa, though, will continue to be providing a written report to the KNA board. And Eva, do you have any follow-up from the last meeting that you gave us a presentation on school nurses? Anything that you wanted to bring to this TAC?
Nothing outside of CMS issuing a memo on August the 18th about expanded school-based health services in Medicaid. So this is very much a nursing issue, but it's also other health service providers. And so the Department of Education is charged with raising up a technical assistance center, and CMS needs to update their guidelines for states and districts on school-based services. I think one of their items was last updated in 1990 something and the other in 2003. So much needed updates are coming with that. And they're calling on states to do a much better job with coordination of care between what's happening with school districts and with other providers. And so I think that we have got some great opportunities coming up in the state to really improve the health of lots of folks, children especially, but this also can go a long way in connecting adults to services as well. So that updated. I think the other thing I had gotten the question about any specific data requests that we might have. Justin, is it Justin? I saw that Lee retired. But so some things I think that would be beneficial for us as a TAC to look at would be, you know, how many districts are participating in the expanded Medicaid billing? And then what do those services look like? What kinds of services are they providing? And I don't know if it's a question that I know Medicaid, you may have this on file. This may be a Department of Education question, or they may be posted somewhere, but who are the folks in the local education agencies that are the Medicaid billing coordinators? Are they, what kind of service providers are they? I know historically it's been predominantly special education directors. And if that's still the case, you know, I just think it'd be beneficial for us to be looking to see who are coordinating services. And then the only other thing I would add to that is the memo that CMS sent out, and then I've been on a subsequent meeting since then with the CDC was part of that call, and they were talking about this memo and the changes coming for school-based health services. One of the great big issues that we've had historically for billing in schools is privacy issues. So HIPAA will allow provider-to-provider exchange of information, but schools are under FERPA, and that's a records law that doesn't have any provisions for this type of medical information. So on a federal level, they're looking at that. CDC is working with the Department of Education because they promulgate the regulations for FERPA to update and to look into what kinds of things that they can do to reduce a lot of those barriers. I guess the question I would ask from a nursing perspective is when we're billing for these services, we have to follow HIPAA compliant platforms. So where is the so what exactly can we get some clarification on what is FERPA, what is HIPAA, and is the billing piece entirely under HIPAA? And that becomes important when it comes to the Kentucky Health Information Exchange, because services provided in schools right now, the providers, the medical homes for these students that have medical homes don't have any knowledge of what's happening in the schools. And could we be doing things to help reduce those barriers to make sure that we're coordinating those services? I don't know if that impacts you, Dee, in your practice, but it's just been a longstanding issue. And from the other perspective, which we're looking into our area providers to see about getting view-only access to their health information system, because they can share provider to a provider, but we in the school system don't have the ability to reciprocate that, which is a problem when it comes to making sure services are being provided. That's all I have, which was plenty, I know.
No, that's great information, Eva, and I like your data request. And I would like to have maybe Justin, who replaced Lee, if you could introduce yourself to us. There may be more data requests that we have.
Yes, absolutely. My name is Justin Derringer. I'm the Assistant Director and Acting Director for the Department, or I'm sorry, for the Division of Healthcare Policy. So as you know, we all had a reorg, and we reorged the Department for Medicaid Services, basically the old Department for Policy and Operations. We split into two different divisions, and then we added a branch of child and maternal health. So all of our long-term services, like nursing facilities, hospice, private duty nursing, nurse aid training program, all of those went to the new division of long-term services. And then we picked up the child and maternal health branch, which is a new branch. So it's a new division, and I'm excited to be leading it at this time. And we welcome any policy questions that you may have, any issues that you may have, and any data requests that you may have. Absolutely. So we're happy to help. Happy to help you all get whatever answers that that you need answered, and just submit those to us, and we'll get on those and work on those. It's been a kind of a difficult time with Lee retiring and right in the middle of the transition, because everybody's kind of learning their new roles and their new assignments. And then on top of that, we're kind of transitioning also back into work at the same time. So it's just a little bit different. But yeah, as Aaron put up, send any data requests to her, and we'll be more than happy to help and do what we can to assist you all with whatever you all need assistance with.
So that's very helpful to know, what we do with that, what the chain is for the data request. I think if we as a group bring any requests through Aaron, just mention during our meetings, I think, so that we're all informed, like Eva just did, in requesting the number of districts that are participating and what services they provide. So Eva, if you want to put that request into an email, just loop us all in.
Okay.
And since Lee offered providing data to us, there were a couple of things that I wanted to dig into a little bit, and they revolve around APRN practice in Kentucky. And so my data request, and I'm going to put this into an email, is that we compare what the APRNs in Kentucky, how many there were like 5 years ago, and how many there were in 2021. And what their certifications are in. How many F&Ps do we have? How many CNMs do we have? and just compare, how the number of APRNs has grown in the last 5 years. So that's my data request. And I'll also email that to you, Aaron, and loop the TAC into it. So that was my big request. And obviously, since our other members aren't here, they are not having an opportunity to bring those to this meeting today, but hopefully our requests, Eva, will stimulate their, asking for specific data, maybe regarding their own specialties. So thank you so much for that introduction, Justin. Now I know where it's going, and we'll keep asking for more information on that.
You have a question that I forgot to ask. Just can we have an update on where things are as far as the updated school technical assistance guide for the school-based services?
Yep. So we're working on that. We've got a task force put together that is, they've done a lot of really good work. They've reached out to several other states, several local and federal and national agencies that work on school-based trainings, and they put together some really good information, really good training programs, a lot of good plans moving forward, and they've got a lot of good partners they're working with as well. We've got a presentation that we're setting up with the commissioner to kind of go over it and go through it. Once that's all approved, we can share that and share our plan, and it's a lot of good stuff, including a large drive and push to send out promotional material and to be active recruiters and recruiting people to get involved with those programs and learn more about them, be educated and trained in them. So I think it's going to be really good. Y'all are going to be excited about it and like it, I think. But that's kind of where we're at right now, setting up, getting stuff finalized and set up for that final approval so we can start sharing that.
So when you say commissioner, you mean the Medicaid commissioner?
Yes, ma'am.
Okay. Thanks.
You are very welcome.
I'm just looking at that chat. Is that Aaron that's asking, make sure to add data request to new business so that it is prepared for the next meeting? Got it.
Yes, ma'am.
Got it. I don't have anything else as far as any new information to add about maternal health topics or the follow-up from any movement on my recommendation several months ago to recommend to the MAC that we as APRNs have 100% reimbursement of the physician fee schedule. So the MAC really took that and made that recommendation. So we're just on hold for maybe a little revisiting that request on DMS's part. So I really don't have anything. I've not heard anything. I've not had any further feedback from the MAC or DMS on that request. So can anyone add to that?
I don't have anything to add to that, but just want to share that the pediatric TAC is having the MCOs present data on immunization compliance rate, and they're asking those as with a breakdown with race and ethnicity to just be trying to better capture where health disparities are. And so and physical exams as well, those preventive health exams, because our numbers have been so low in Kentucky and worse since the pandemic. And so those will be good things. I think that will be helpful for our group as well, just as we look at, as you're looking at maternal child health issues for one thing. And the other thing is just with school-based billing and the services that can be provided in schools to help reduce those disparities for those kids that don't have transportation or have great issues with the social determinants.
Eva, do you need specific data points to look at?
I don't know. I guess I can think on that and include that with the email I send out. That's a good thought.
Sounds good. As far as new business, we were going to,
Hey, Dee.
yeah. Hi,
Hi.
Holly.
Hi. This is Holly with Anthem. I would just, I know this is a newer TAC, but any of those formal requests for data, we're happy to provide that for you guys. If you could just send whatever you need over to our regulatory departments, that way they can head that front and get all the data that you guys need.
Thank you, Holly.
Thank you.
And moving forward, we were going to come up with some meeting times for hopefully till the end of this year. And since this is the end of August, I guess our next meeting would be in October. And I'm gonna,
We already have a schedule set. Your next
Okay.
meeting is October 13th. And then your
I
next
see.
meeting after that is December 8th.
October 13.
And I am currently working on the schedule for 2023.
And did you say December 8th? Got it.
December 8th.
Okay. I look to be available for those. Eva, how does that look for you?
Yes, I'm good.
Sounds good. So from there, any input from the MCOs? Is there anything that we can answer or dialogue about?
I might ask a question that the MCOs can answer. So, well, maybe not. So some of the nurses in states across the country work pretty closely with their MCOs. I would just be curious to hear from the MCOs on what kind of things would be helpful as far as partnerships with school nurses or school health staff that could help meet outcome measures for children that we should be thinking about as we move things forward.
Anyone want to respond to that, or maybe we can table that until our next meeting? Is there anything more on the agenda, Erin? If you could go down, page down. Yeah, that was it. So since we don't have a quorum, there's really nothing more that I have on the agenda today. So I want to apologize for my colleagues, and hopefully we'll have more productivity going forward and better participation. So I appreciate everyone's attention, and I appreciate your participation with us in this nursing TAC. That's all I have.
Thank you.
Thanks, everyone.
Thank you.
Thanks so much, Erin. Have a good afternoon.
You're welcome. Have a great day.
Thanks.